Welcome back to KXAN News Today. Late last year, St. David's Medical Center became the first facility in Texas to use a special type of implant technology. It's part of a clinical trial that links heart health to a patient's risk of stroke. And here to tell us how it works is Dr. Rodney Horton. He is a cardiac electrophysiologist at the Texas Cardiac Arrhythmia Institute at St. David's. That's a lot. So you got to tell us first, what does a cardiac electrophysiologist do?
It's just a heart rhythm specialist. So someone who's a cardiologist first, and then they specialize specifically in rhythm disturbances.
Okay, so now you have this new technology
Yes.
that uses or that looks at the rhythms of the heart.
Well, what this particular device does is it closes a portion of the heart that is responsible for strokes in the majority of people who have atrial fibrillation.
Okay.
So,
Atrial fibrillation is?
Atrial fibrillation is a chaotic rhythm that is very common in adults. It's more common as we get older. And with atrial fibrillation, you have roughly a 5 times greater chance of having a stroke.
Okay.
In people who don't have severe valve disease, the left atrial appendage, a pouch on the side of the heart, is responsible for those strokes.
Oh.
So we've been involved in a number of studies for about 12 years to close the appendage and eliminate that source for strokes.
We never, at least I don't, connect the heart to a stroke, because when I think heart, I think heart attack, and then when I think stroke, I think brain.
Right. The problem is that when people have atrial fibrillation, a blood clot can form in the heart, break loose, and go to the brain and cause a stroke. And that's one of the more common reasons for strokes.
Okay, so now we got all the background. So now you have this device.
Yes.
And what does it look at? What does it do?
Well,
measure.
What it does is it doesn't measure anything. What it does is it is placed into that pouch, into the appendage, and it prevents any blood from going in or out of it, thereby preventing that being a source of blood clots and strokes in patients with atrial fibrillation.
Okay, so these are patients with atrial fibrillation. Who's mostly at risk for that? Give me the demographic. Is it men? Is it women? Do they fall in a certain age range? Who are they?
Actually, women have a slightly higher risk of stroke compared to men. That's an independent risk factor. People who have the atrial fibrillation have different risks. If there are other health issues, they're at higher risk. So if they have diabetes, high blood pressure, age over 65, those are the things that would result in a higher risk of having a stroke with atrial fibrillation. However, the common treatment for that is blood thinners.
Okay.
And blood thinners can lead to bleeding. And so particularly in patients who bleed on blood thinners but are at risk for strokes with atrial fibrillation, this is a perfect solution because it simply eliminates the risk of stroke, ultimately without the need for blood thinners.
And St. David's is the first medical center in Texas to get it. How was St. David's identified as the place that it should be?
Well, we've been involved in research studies for about 15 years, and many of these types of structural heart things, we've been sort of at the forefront of the research in. I've done studies like this and procedures like this in Europe several times, helped to design some of these studies and some of these devices.
Now, so patients are listening to this morning and they say, you know, how do I know if I'm in this category? Does my doctor have to diagnose me before I need this device? Or can I say, hey, I have all those symptoms, I should bring this up to my doctor? Well,
it's a lot of these. Sometimes the patient knows these symptoms and can bring it up to their doctor. A lot of times the doctors will have a conversation with the patient about atrial fibrillation and explain that some people are at higher risk than others. And then sometimes these conversations happened years ago, and then the patient presents with a bleeding issue. And then suddenly you have to have this conversation about, okay, now what do we do? If we stop your blood thinners, you might stroke. If we continue the blood thinners, you bleed.
Okay. So it's a good thing for patients and for St. David's that you all have this, and it's called, just so that we get it out, Amplatzer? Amplatzer?
Amplatzer, or the amulet is the name of the device.
Okay.
And it's this particular device is made by St. Jude, a U.S. company, and this is a study, so it's comparing this device to another commercially available device that we were also involved in studying.
So more technology could possibly come out of this.
Yes.
Dr. Rodney Horton, thank you for breaking down, first of all, what a cardiac electrophysiologist is, but this was really good.
So, thank you.
All right. Still